The African nation of Uganda is in the middle of a deadly Ebola outbreak.
The United States was providing on-the-ground humanitarian assistance until President Trump pulled the plug on USAID.
The loss of that help raises the risk not only for Uganda, but for the rest of the world as well, including the U.S. Debora Patta reports from Entebbe.
As soon as we stepped off the plane in Uganda, we noticed a lack of health screening.
There seemed to be one person possibly monitoring temperatures. It was unclear.
There should be at least two, but it's been scaled back due to US funding cuts. Right in the middle of Uganda's 8th Ebola outbreak. The first case was reported 9 days after President Trump took office. USAID was leading the emergency response when all of its 37 staff here were fired. We spoke to one of them, a senior USAID official, and voiced over her words to protect her identity. She told us Uganda's health system has been crippled by the cuts. How does the crippling of the health system in Uganda impact Americans right now?
Someone with Ebola could board a plane and end up in the United States.
Is America a little less safe?
Absolutely. It makes our ability to detect and respond to disease much weaker, and that makes us less safe.
We reported from Liberia during the deadly 2014 West African Ebola epidemic, which claimed more than 11,000 lives and cost the US over $2 billion to contain. But it still spread to America, killing 2 people. Since then, USAID has been at the forefront of combating the disease. All the doctors we've spoken to here tell us they are very worried that the fight against infectious diseases, including Ebola, could quickly get out of hand without American funding. USAID helped pay the salaries of 35,000 health workers. They've all lost their jobs. And this US-funded clinic is already battling shortages, where doctors check for the initial symptoms of the virus, fever. In their labs, these $200 test kits can diagnose Ebola in less than an hour. They all come from Salt Lake City. There are only 300 left. Clinic Dr. Kenneth Korber said they are running out of time.
For this kind of diseases, you cannot afford even a day of waiting.
Deb, in 2014, after the outbreak, U.S. policy was to stop Ebola there before it came to the United States. What's the status of that now?
Well, John, in Uganda, it's called a preemptive strike. But the cuts also mean that frontline workers who hunt for new infections have been axed in 146 districts. And without them, there could be undetected cases spreading.
And Deb, for Americans who wonder, we can't be the world's doctor. Is anybody else stepping up to fill the void?
The World Health Organization has stepped into the gap, Maurice, but for how long? Their funding's also been cut. And as the USAID official told us, this was a good investment. Uganda's 2 flights away from the US. American doctors are not trained to detect Ebola. Frankly, I'd rather be treated for it here.